Yes, yes, yes. I'm your host, Manon Sabir, the Grapevine, and welcome back. We're about to pick some grapes. I need Milwaukee to pull up, and I want to give thanks to Shannon and Ray for giving us that real talk. And I'm excited. I'm excited, man. I woke up and I looked at the clock, and it was 3 a.m. and my daughter was moving around the house like she was Casper the ghost. So, yeah, I've been up since then, basically. But I'm here. And she's pretty much upset right now. She's upset because she's at camp and she can't go swimming with the people. I told her, like, she can't go to camp to swim with folks that I don't know. And the people didn't even answer my questions on the safety of the children. So I'm not going to say which camp, but I'm going to say that y'all need to get it together. I'm going to talk to y'all in a minute. So my daughter is not going to swimming. She can swim, and she can swim. She's a fish, but she's not going to go. But welcome, Milwaukee. That was my word of the day. Keep your children safe. We already were talking about that all day. Keep your children safe. Don't give them the thing. Don't give them like the addendums, the computers, the laptops. Let it go. It's summertime. Tell them to go outside, or sit on the porch. You get hot a little bit, come back inside, get you some whatever you need to get. Like some food or water or whatever. So glad you pulling up. Glad you turning up. But tell somebody in the room to come listen, because this afternoon is not regular radio, and I need you to understand that from the jump. So before we get into anything, I need to give you a word, and it's not my word. It's a word from a man who understood exactly what it meant to fight for people in a system designed to crush them. It was Martin Luther King Jr. said it plain. He said it plain. And I want you to hear it today like you've never heard it before. Injustice anywhere is a threat to justice everywhere. Now, injustice anywhere is a threat to justice everywhere. So not just in Birmingham in 1963, not just in Selma in 1965, but right here, right now, Milwaukee, Wisconsin, July 1st, 2026, on the hottest day of the year, one of the hottest days of the year. And it feels like 107 degrees outside from what I heard. But in the most racially segregated city in the United States of America, injustice is right here on the north side, where 7 grocery stores have closed in the last year. I think it's 8 now, and the fast food joints, they stay open. They stay open, close to 24 hours. The owners go home maybe like at 11, they come back at 7. Or, they get back up at 5, but they back on the job. And our grocery stores are closing down. So injustice is right here in the rivers full of PCBs that were dumped. That's forever chemicals, basically, that were dumped into black and brown communities, neighborhoods, while the suburbs got the clean parks, the clean playgrounds. It's clean. Injustice is right here in the delivery rooms, where black mothers are dying and at rates that would be front page national news. And if it was happening to any other group, honestly, we have to remember this. If it was happening to any other group, injustice is right here in the mentor programs, that we can't find enough men to show up for boys who are waiting. I think from what I heard from another report, maybe on this station, it's about 400 boys on some waiting list for mentoring. And I'm not giving the soothsayer delight, but there's 400 boys on I think it's Big Brother Big Sisters waiting list or something of that sort. And I could be wrong, but somebody call in and let me know. 833-212-1017. And today, on July 1st, we're sitting in the heat dome. We're sitting in the heat dome that's hitting our community harder than anyone else, in some ways because of racist housing policy decisions that were made before some of us were even born. It's a 107-degree heat index. I'm going to repeat that. It's a 170-degree heat index. Like tonight, today, right now, it's going on. It's a 170-degree heat index. So what it says on your thermometer, barometer, whatever, what it says on your temperature gauge may be 90 degrees, maybe 91, 94 degrees. But what it feels like is 107. And we are sitting in the middle of it. So this is The Grapevine, and I'm your host, and we're on 101.7 The Truth Radio, and for the next 3 hours, we're going all the way in. So it's no cap, no filter, no sponsor telling me what I can and can't say on my show. And it's about my own city, my own people. We're going to be talking about your body. We're going to talk about your body and what this heat is doing to Black Milwaukee right now and what you need to do today to stay alive. We're talking about silent killers, hypertension, maternal mortality, and diseases that are taking a lot of people before their time. We're talking about food swamps. If you don't know what food swamps are, please look it up. I'm gonna try to define it so you'll get the picture. But food swamps that are drowning our neighborhoods and what a lifetime of processed junk food actually does to a Black body year by year and by disease. And we're going to talk about our kids. We're going to definitely talk about our kids, what they're eating, how they're moving, and more accurately, how they're not moving, what school districts and parents need to do differently right now. I'm really excited because I want to definitely continue that conversation, as I started it last year. I started it yesterday, and I want to make sure that we have some addendums in relationship to that particular conversation, because our kids are, our future, and there's nothing wrong with continuing that conversation. So I appreciate it that if you are able to tune in, please tune in. And then we're going to talk about the Strawberry Fest in Cedarburg. The Strawberry Fest in Cedarburg, sundown towns, Rosewood, what the actual geography of how this state tried to keep Black people contained. There's a story real quick. There's a story about Rosewood, and I'm going to cover this later on, but Rosewood is a city. It is still around. Is a city in Florida. I think it's Central Florida, somewhere around there. And it contained at one point, a thriving Black community, and then white influx chased Black people out and around the community. But it's not just an old story. Some of these stories are still happening today, where yes, now you have Black people on one side, white people on the other, separated by a train track. I had some friends that went to protest in Rosewood, Florida, out of Miami. They went and protested in Rosewood, Florida, and they were met with people who were telling them to get across the train tracks before the sun went down. Plain and simple. And these people, the Black folks that were coming to protest, were armed, heavily armed. So that's the nature of what has been going on in our community. And what can we do? What can we do about if a community, they say they want our money, they say they want it, but they're not reflecting it in their charter and mission. and also in their economic prosperity. They're not saying it. So what do we do as, or what do the people do that are not necessarily invited on a regular basis to those communities? It doesn't have to be Cedarburg, because it could be any other place. But Strawberry Fest, we're gonna talk about it, and then we're gonna talk about how a $122 million toxic waste facility being built in our lake right now. 8 days ago, reporters walked through that construction site, and Milwaukee barely talked about it. A Wisconsin woman fought off her kidnapper on the trail yesterday afternoon with her baby in a stroller. And what every woman in this city needs to know about how to do the same. And our women, if they are not protected on both sides, all sides of the fence, all genres, all cultures of folks, then we haven't done our job. We have to do our job. So 3 hours, a few segments, one city, everything connected, everything's grounded in Milwaukee, everything's grounded in us. If you're locked in, please stay locked in. If you just found us, welcome home. We are the Grapevine, and it starts now.
Brought to you by the Ad Council.
Welcome back to the Grapevine. I'm your host, Manon Sabir, and we're about to pick some grapes because let me start with this urgent thing that's happening right now. The heat dome, the heat index is July 1st, and it feels about 107 degrees outside. I'm gonna say that again, 107 degrees. So your body, when you walk outside, it's gonna feel like 107 degrees. So it's hot, 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 hot. And the overnight lows pretty much are staying at about 70, which means when the sun goes down, you still gonna feel like your body there's no time to recover. So now, before I give you the resources, I'm gonna give you specific resources right now. I need to explain something that the weather report is not bringing up. It's not going to tell you, because the weather report just don't tell you the temperature. It doesn't tell you who suffers most from that temperature in Milwaukee. In Milwaukee in particular, we're just talking about Milwaukee. We can talk about many other places, but in Milwaukee in particular, this is not a random outcome. This is very documented, measured, and a predictable result of decisions made, years and years and years ago. So Black Americans are 52% more likely than white Americans to live in what we call urban heat islands. And so I think what they call an urban heat island. The urban heat island is a neighborhood, usually like a pretty dense neighborhood, where there's significantly fewer trees. There's way more pavement, there's more concrete buildings, and a little bit of green space. So, I think you may say to yourself, especially if you are depending on Milwaukee kind of does a good job at this, but especially if you're living in Milwaukee, you may have like that egress, you may have a front yard, backyard, or you're living in a duplex and you may have the same exact thing. You probably see it. But, over a period of time, a lot of our trees have been either taken down and or diseased. And so, we've been losing green space more and more, especially as our buildings have been going up, trying to combat the housing crisis here in Wisconsin, also in particular Milwaukee. So all of those surfaces absorb heat. So like all those non-green space sources absorb heat throughout the day, and then it radiates back upward at night, which is why the overnight lows do not drop the way they should. So, which is why your neighborhood basically at 11 o'clock, at 11 o'clock might feel like it's 15 or 20 degrees hotter than the neighborhood 5 miles, west of you or wherever, 5 miles north of you. But that has more tree cover and significantly less pavement. And so the question is, why do black communities end up in heat islands disproportionately? So why is a disproportionate amount of black neighborhoods wind up in on heat islands, around surrounding heat islands, right? Like, why are we next to them? We shouldn't be. But you already know the answer. I'm not gonna give it to you, But yeah, I guess I will. It's structural racism. We know it's systematic racism, and the answer really is redlining. Redlining did its number. We're gonna, we've talked about redlining many, many times before, around on this show and other shows. But beginning in the 1930s and for decades, the federal government and private banks used like maps, color-coded maps. I always say they just basically drew a red line around black neighborhoods as high risk for mortgage lending. So that policy was explicably racial, like high level. So it concentrated black folks in specific neighborhoods, while simultaneously cutting off like other investments. So that would have and plus those investments would have maintained parks. It would have planted plenty of trees. It would have built green infrastructure, like all of that. It would have helped tremendously. That's why when you go out to some of the suburban areas, you'll see kind of a well-designed, well-placed type of greenery structure out there, or greenery infrastructure out there, versus the one we have here in the city. Luckily, we have, and as opposed to other cities, we have a more of a robust park system than not. But then with our cities, we do have heat islands, or with our neighborhoods, we have a lot of heat islands. So our kids are outside and they're just burning up, like straight under the sun. So researchers documented that formerly redline neighborhoods run on average nearly 5 degrees. They run 5 degrees hotter than non-redline areas in the same city. And black Americans are 52% more likely to live in those hotter areas. That's just the truth. These are statistics that we don't have to debate. That's just how it is. So like on a 170 degree day like this, you have people who aren't necessarily landing outside those neighborhoods, and that comes at the tail end of a 90-year-old racist policy, and it lands literally on that 90-year-old racist policy lands right on your body right today. So as you're picking spots to cool your body, cool your mind, guess what? You also have this particular racist policy that you're coming up against. So now layer on that, research shows 15% of black households lack air conditioning. Yes. So compared to other white households, in comparison, like we don't have air conditioning. So when the heat index hits 170 degrees and not having air conditioning is not an inconvenience, it's a medical emergency waiting to happen. Yep, it is a medical emergency waiting to happen. So if you do not have air conditioning, please, it is real. It is real. Like, it's a medical emergency waiting to happen. Now, I know a lot of homes are being outfitted with central air, but there are many homes that do not, many apartment buildings do not have central air installed. So you have folks, I was riding past one apartment unit on the south side, and man, they just did not have central air. It was like a lot of fans, blowing in and out in the windows. Yeah. So, and then this is, because this is Milwaukee, and every health conversation has to reckon with what our community is already carrying. Black Americans have significantly higher rates of hypertension, diabetes, cardiovascular disease. And a lot of these diseases are preventable. So, for example, if you go to the store on a very hot day, your first choice should not be something that will create more heat in your body. That your body has to create heat, because your body creates heat in order to break down food. That's plain and simple. Your body has to create heat because it already has heat, but it has to create more heat in order to break down food. So whenever you feel this 107 degrees, guess what's happening to you? Your body is magnifying that heat that it already has in order to break down that food. And if it doesn't have enough inertia, then it's going to be hard for that body to break down food. Therefore, ultimately, and sometimes leading to different health ailments like, hypertension, colorectal cancer, diabetes, cardiovascular disease. And all three of these conditions affect how your body regulates its temperature. So your body's temperature will go up and down. This is very serious. So yeah, I'm not just harping on this just because this is something that we all are facing on a daily basis. These are choices. These food choices are choices that we have to, reckon with every day, and we have to continue to control ourselves. So basically, if you look at a person with heart failure, and they can't pump blood to the skin surface to release heat the way that a healthy cardiovascular can, a healthy cardiovascular or person can, it's going to be hard for them to recover. So we're entering today's heat emergency already carrying more physiological risk than the general population. We're hotter neighborhood. We have less AC and a higher baseline disease burden. And that's 3 strikes before the day even starts. And I'm not trying to say like, man, there's nothing we can do. There's a lot we can do. There's a lot, but you guys have to act. We have to act as stewards in our own communities. We have to act as people who actually care. If you are a person who is very healthy or healthy enough, please go check on the people around you, your neighbors, and also your elderly folks, because they're sitting in those houses and they're hot. Like, don't take it for granted that just because you come from an air conditioned, apartment or house or whatever, doesn't mean that those people have the same type of situation set up. So when we come back, we're going to continue with this conversation about our heat dome, and what's going on in Milwaukee, and how our kids can bypass the heat when we come back in 2.
Wherever there's a need in our communities, there's a United Way, improving lives so everyone can thrive. Where more people can gain access to healthcare and nutritious food for their tables. Where more community members can benefit from financial education and get
pick some more grapes. But we talking about our kids. We talking about our kids in this heat. I went outside and I started sweating instantly my daughter was like, man, she was, I mean, our car has air conditioning, but she was like, Dad, it's hot. Like, I'm trying to get her in the car. She's like, Dad, it's hot. Just close the door. Man. Well, before I began, I was just reminded. I was reminded by watching Nas on the BT. I mean, he had the lyrics that he said on his song with Lauryn Hill, "If I Ruled the World." I mean, those were some telling lyrics. But I like this last phrase where he was like, "'Cause if you could have all the chips, be poor or rich, still nobody wanna end having ish. If I ruled the world and everything's in it, sky's the limit. I push a Q45 infinite. It wouldn't be no such things as jealousies or be felonies. Strictly living longevity to the destiny I thought I'd never see, but reality struck. Better find out before your time's out what the and it's real. Like, it's time to wake up. It's time to start caring. You know, he's right. You better find out before your time's out what the let's find out. Let's find out about ourselves. Let's move in a purposeful direction. So I'm going to talk about our kids. I'm pretty sure that he was speaking to the legacy. You know, he was speaking to the individuals that weren't just listening to the song, that were older. He was speaking to the people, and that's what hip hop does. It speaks to the young folks tremendously. That's what it is. It was made from the young folks, and it's going to continue to live on with the young folks. And I'm speaking to our young people right now, and it's, you know, not just our children, but individually our black children. Our black children are over 7 times more likely to die from asthma than white children. And if you can imagine having asthma in this heat, imagine having something pressed up against your chest and somebody's pressing on the other side on your back, and they're just, you know, squeezing it, and then they release it, and they squeeze it again, and they release you, and they squeeze it again, they release you. That's how asthma feels to kids, not just kids, but also anybody who's dealing with asthma. And yeah, it can be really, 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 really scary. I think in the last couple of days, some kids were hospitalized due to asthma, but then a number of there were some other kids that there were kids that passed in these last couple of months in relationship to asthma. So asthma is real serious. So there's a direct heat and asthma connection that every parent needs to understand. Every parent needs to understand. Extreme heat increases ground level ozone. So what we call smog in the air, smog is a direct trigger for asthma. So during extreme heat events, asthma-related emergency room visits are more than 3 times higher. They're more than 3 times higher among black children than non-black children. And if your child has asthma, today is not an outdoor day. Just give your child a book, some crayons, some colored paper, allow them to shoot spitballs, whatever you got to do. Spitballs, paper airplanes, paper mache, whatever you got to do to keep that child inside the home, make sure you do it, because today's not the day. And also, I want you to know the signs of asthma attacks. So shortness of breath, wheezing, chest tightness, coughing, all that's not going to stop. So in severe cases, the child having asthma is going to have difficulty speaking because they can't get enough air. So parents, daycare workers, people who are in charge, administrators, whatever you are, wherever you are, and you have children around you, and if you know that child has asthma, and even if you don't, look for those signs. That's very, very important. So heat stroke versus heat exhaustion. Basically, you should know both. Heat exhaustion is a warning stage: heavy sweating, dizziness, nausea. Your skin starts to get clammy, muscle cramps, all of that. Get some shade. Go to air conditioning. Don't wait. Do not wait. If you find somebody that's on the side of the road, usually if they're having a heat stroke, you'll understand those. You'll see those symptoms. So make sure that you try to, if you see somebody in that state, make sure you go to the ER or call the emergency number 911 and get somebody to them ASAP, because their body temperature usually is at or above 103 degrees. And that hot skin could be, hot skin that may be dry and wet. It's like, these people can lose conscience. So please get that taken care of. You can go, and if you aren't sure of the symptoms, you can hit, look online and get all this information too. If you're hot in your house, please call 211. Call 211. You can go to Milwaukee Public Library. You can sit in a hospital or emergency room and just get some air. It's you ain't got to check in. You just sit down. There's business buildings downtown. It's banks. Go to a place that you could find cooling, please. And fourth, and I've said this before, I'll say it again because we don't do this enough. Check on the old folks. Check on the elderly neighbor. A lot of your family members do not have AC, and they may be living alone. They may be living alone. And fifth, I can't say this enough: do not leave your children in the car. Please don't leave your children in the car. Like it is one of the worst ways to conduct your family. That's, for lack of a better word, it's one of the worst ways to conduct your family. Like, Mike, come on, don't leave your children in the car just so you can go running and in the Walgreens and get whatever you need to get, or to the Zaza store, wherever you got to do. Please don't leave your kids in the car. I think there's probably a number of individuals that do that, and they probably still do that. They probably gotten away with it, but you can't get away with that stuff, man. I mean, not on hot days. But I want to switch subjects, and I was reminded that talking about kids, I'm thinking that I want to ask a question to everybody. What is really killing us? Like, we got a number of topics that we can go, like hypertension, Black maternal mortality, infant mortality, mental health. And I want to be honest with you, and I want to be honest with myself when you answer it. For example, what is your blood pressure right now? What does your blood pressure read right now? Mine was, when I went to the doctor, I think it was like 116 over 70 something. So it was basic. My blood pressure was basic. It was cool. But I want to know, like, what was your reading from 6 months ago? Not what your doctor told you at your last appointment. What is it right now? Like, what, and do you know? Or does your partner know? Does your partner know theirs? Like, we're sitting on, this is almost like a powder keg. Do your parents know theirs? Or your parent? Does your parents or parent know theirs? And here's why I ask that question that matters a lot, and especially in Milwaukee, is that I guess for non-Hispanic Black adults who have the highest age, adjusted mortality rate tied to hypertension and diabetes combined of any racial group in this country. So not a slight difference, but a significant, documented, measured difference, measured gap. And when Black patients end up hospitalized for hypertension, for a health crisis that should have been caught and managed before it became an emergency, the data shows that they die at higher rates than white patients being treated for the same condition. This is the same disease, same hospital, different outcomes. And this is what structural racism looks like in the medical chart. And they call hypertension the silent killer because it has zero symptoms. It has zero symptoms. When those numbers come off the chart, you don't know what's going on in your body. You don't know that those numbers are off the chart, especially if you're in, either a fight or flight mode, all the time. If you're stressed all the time, you don't know that those symptoms are constantly, going up and up and up. When we come back, we're going to tackle hypertension, infant mortality, and the Black maternal mortality rate and what's going on. When we come back in 2.
Oh, yeah. Oh, CMG days cracking. Dropped a few albums, label think that I ain't have it. LA Supermax, I had to sit, this was tragic. Suge Knight on the top floor, prison house madness. Running phase.
Man, who is that?
Wave Chappelle.
Wave Chappelle. Man, we need to play him all the time. Yeah, Wave. Man. Oh, I got to have him back on the show. What's up, Wave? Shout out to Wave Chappelle. Man, him doing that. Fantastic, man. I might start freestyling. I tell everybody, I might start freestyling all the time. No, that's all good. I'm going to go to the chat real quick. 833-212-1017. Before we go to the chat, what the business is. Looking to discover, support local businesses in our community. Then make sure you tune in every Friday at 8 a.m. to Truth in the Morning with the legendary Home or Below and Bailey Coleman for What the Business Is, powered by We Energies. Each week, you'll hear from local business owners as they share what their business is, where they're located, and one valuable lesson they've learned along the way. We Energies is proud to help power local businesses and communities they serve. Don't miss What the Business Is every Friday at 8 a.m. only on Truth in the Morning with the legendary Homer Blow and Bailey Coleman, powered by We Energies, delivering the energy that powers local businesses. So, shout out to Wade Chappelle again. Yeah, I've been talking about health. I think this is the best time to do it because we are dealing with a lot of things in our community, especially the heat dome that's sitting right over Milwaukee. Like, it's sitting over the Midwest. It's sitting over like all the middle part of and parts of the East Coast. So it's sitting right there. We got all of these weather disasters going on. Shoot, if you look at Accra, Ghana, they've been having a lot of flooding. I think in Iowa or Idaho they had some hailstorms with water and with rain. It was just a lot. It's just a lot going on. We got earthquakes. So, I say that our world is a macrocosm of the micro universe that we're dealing with, and not just we as in Black people, but people all in general living in this world. And we do find happiness. Your body finds happiness. And if we are to be honest with ourselves in relationship to how we're treating our bodies, we have to talk about specific ailments. And one ailment I've been talking about in particular has been the hypertension. Has been hypertension, and it's doing some damage. It's doing some damage. Black women, and I'm gonna talk about the black women, not because they need to be tamped down on, but black women, we need to also save them too. If you look at black women are dying in delivery rooms at a high rate, at one of the highest rates out of all genres and cultures of women. And in following weeks, following delivery, women have been having it. I'm not a woman, but you guys have to. You've been dealing with this, and we want to talk about it. I want to talk about your health, maternal health. That black women die from pregnancy-related causes at a rate of approximately 55 women to 100,000 live births. So it's by far the highest of any racial group in this country, and that number hasn't been going away, hasn't been falling at all. It's been climbing. It's going up. It's going up. It's rising. It's not going down. I'm pretty sure 30 years ago the number was a little lower than that, but that's a lot because babies are being born every day. They're being conceived every day. But our women, they have to be saved, and there's you got hypertensive disorders of pregnancy, specifically pre-eclampsia, and they're one of the leading drivers of those deaths. So pre-eclampsia is high blood pressure during pregnancy that can progress rapidly to like organ damage or life-threatening complications. And the research is a little unambiguous, is devastating, even when researchers control for underlying health conditions like hypertension, diabetes, and obesity. And the racial disparity, it, even when you think about it, you can focus on the disease, on hypertension, but the racial disparity in maternal death does not disappear. So I'm gonna say that again because it's important. When you remove like the underlying health conditions from the equation, you remove the underlying health equations, conditions from the equation, black women are still dying at higher rates. So that tells you that this is not fundamentally about individual choices, because if they're dying as a group, it's not about individual choices. It's about how black women are treated, how if they're heard, believed, and responded to in clinical settings. So mind you, if you got a woman who's going into the hospital and she's saying, hey, look, I'm having this issue, I need somebody to hear me. And the doctor is saying, oh, just stop working, those 30 hours. Some women who are pregnant are still working 40 hours. Stop working those 40 hours. Just go home and get some rest, put your feet up. Yeah. No, I need you to listen to me. I need you to hear out what's going on in my life. I need you to hear me out what's going on in my body. This is disproportionately affecting black women, y'all. And this documented research showing that a black patient's pain is more likely to be dismissed or undertreated than white patients reporting the same symptoms. And this is the truth. So there's plenty of documented research. That's why we have this particular report. Serena Williams, she was just on TV at Wimbledon. She's at Wimbledon? Yeah, she's at Wimbledon right now. Dang, I miss Wimbledon. I've been there. Yeah. Like if Serena had to fight hard to be believed, like she even talked about this. If she had to fight hard to be believed because I think she had pulmonary embolism. Just imagine with someone who's not a billionaire. Just imagine a woman who is not a billionaire, probably, got some things going on, whatever. But imagine a woman that is not a billionaire faces when she has fewer resources and she has to check into the doctor. So those infant mortality numbers are for real devastating. Babies born to black mothers die at more than double the rate of babies born to white moms. It's a rising gap. It's not going anywhere. We've talked about earlier in the week about our population, the population of individuals being born. But one thing that has to be said is that when you have a pregnant black mom, she wants to be heard. She wants to be heard. So some of you, if you're going to the doctor with your person, your partner, your wife, whoever it is, you going to the doctor, you also as the partner don't disregard who. Yep. Yep. This is the Grapevine, and I'm Manon Sabir. Don't let me freestyle. We're going to pick some more grapes. Yeah, we're going to pick some more grapes. We're going to pick these grapes. Yes. This is the Grapevine. I'm about to link it all together because to continue on in hour 2 of the Grapevine, and I'm glad you are here listening. We've been talking a lot about health. I know sometimes I could bring it out of nowhere, but sometimes nowhere leads to somewhere, especially in these conversations. This is very, very important. We're talking about maternal health. We've all been born through somebody, and we got to make sure we check in with those individuals that are pregnant and with child. And so my goal for you, if you want to take anything away from this talk, from what I'm telling you, is check in with those people that are pregnant with child, because not only are they dealing with, a lot of times, health, it could be either health complications and or just pregnancy in itself. But their mental health, check on their mental health. Depression and anxiety, you don't want that during and after pregnancy. Isn't just a personal struggle. It's not. Researchers, they identify them as their significant contributing factors to a pregnancy-related death. So if someone is like not doing good in the head, it's hard for them to understand what's going on in their body, because they may dismiss the signs. It could be a whole bunch of stuff. So, untreated mental health conditions, affects the choices that people make tremendously. So help them seek professional help, and make sure they understand those warning signs aren't normal for women that are pregnant. So if it's a lot of resources out here. It's a lot of resources. You go to the Milwaukee Health Department, you can receive high blood pressure screenings. If someone that is dealing with, like headaches or swelling in the face or hands, vision changes, abdominal pain, or something that is wrong, just wrong. Those are warning signs of preeclampsia. So you have to, you got, like, as a woman, you have the right to be heard. So go get that checked out. Make sure they check your blood pressure. Make sure they know what's going on inside your heart, not just your physical heart, but your spiritual heart. Make sure people know about that, and don't allow for anyone to bypass those particular symptoms when you are dealing with them. And if you got, like I said, if you got a partner, your wife is struggling, you got to help them. You definitely got to help them. So, keep them up, help them, rub their feet, whatever you got to do that. So know your numbers, advocate, and get things checked out. But I want to start. I want to switch over to something that, when you do have children, when you got family, you out there, you doing your thing, and some of you have a lot of kids. There's a lot of things going on in the family, and everybody got different situations. Did you ever think about the last grocery store you shopped at, and how far you had to travel to get there? Or did you walk? Did you take a bus? Did you Uber? Did you Lyft? What did you do? Did you get on your e-bike, get on that scooter, wherever, and get there? Were the prices comparable to a place that is out in Brookfield? We're just talking about Milwaukee right now, right? But were those prices comparable? What are you paying for? What are you paying for groceries? Like, I remember I went to Trader Joe's. And I picked up 7 items. I paid, last year for those same items, I paid about $17. And now those same 7 items are at $37. And that's a lot. That's a lot of bread. You can't, that's almost double. That is double the increase. Or yes, that's 2 times what I significantly paid. It's very out of order, y'all. So I'm concerned, because here's the reality for a significant portion of Black Milwaukee right now. Last year alone, there have been 7 full-service grocery stores that closed across Milwaukee County. 7. The north side has been hit at the absolute hardest. And Walmart closed its location on this is Silver Spring. Walmart then closed its location on 70th and Main Street. Kroger's Pick and Save 30 they're on 35th and North closed. And that was just a full scale grocery stores in that neighborhood. All these closed on Sherman and Silver Spring with no notice. River West Co-op closed down, and that was a co-op that was there for like 24 years or more. It closed its doors. Pick and Save announced 4 additional closures across the country. I'm pretty sure that they're in neighborhoods that actually need that food or that store to be open. I'm pretty sure. So, and who's filling in those gaps? And we know what's still there. Corner store stocked with chips, candy, processed meat, or rotten meat. Gas stations with hot dogs on rollers, energy drinks, Kool-Aid, pineapple in Kool-Aid bottles. Fast food corridors. Everything cheap, everything processed, and nothing fresh. Nothing fresh. Just everything brown. No, so let me introduce you to two terms that I want to make sure that we get in our mind. The first term is called food desert. We recognize what is a food desert. You probably heard this one. But then there's three terms. Food desert is when it describes an area that has access, and it's supposed to describe an area that has access to no fresh food. But in reality, that's called a food apartheid. Food apartheid is the system that lays into a neighborhood that has food but systematically takes away food that's healthy for the individuals that are living in that community. So the next term I'm gonna give you is food swamp. And a food swamp is not a place with no food, but it's a place where food is everywhere. So if you've ever been to a swamp, if you haven't been to a swamp, imagine jumping in the ocean and there's like a gang load of minnow fish. All right. This is talk about the fish in the ocean. Bunch of fish in the ocean. That's what's going on with a food swamp. Food swamp is a place where there's a whole lot of food, but not any food that's good for you. It's a place that has a whole bunch of fast food, convenience stores with, fast food type of food, and it's basically all the wrong food. It's flooding our community. It's flooding our neighborhood. So completely flooding our neighborhood. So if you want to make a choice, healthy choices are buried under an avalanche of cheap and also engineered products. But it's really food apartheid. All of this is food apartheid. It's a system of enforced racial deprivation. It's where, when you look at Milwaukee's food environment and how it got this way, through redlining that concentrated black residents in specific neighborhoods, so they kind of siloed all the black residents, and then through corporate decision-making, just deliberately abandoned urban markets for more profitable, suburban ones through fast food companies been documenting all of this evidence. They have it in their data sets. They know it. So they're able to place their stores specifically in Black and Latino communities. So calling it a desert or calling it a swamp makes it sound natural like water, but it's not natural. It's a policy, and we have to name it like a policy. Milwaukee is specifically a food apartheid. I think it's under the state of emergency, under food apartheid. And I've talked about this, but I'm gonna continue to give it to you the way it should be given to you. Now here's what that food environment does to your body over a lifetime. And I want to be very, 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 very specific. Very specific, y'all. Very specific. In the British Medical Journal in 2024, it analyzed about 45 separate studies and found direct associations between ultra-processed food consumption and 32 different health outcomes. Not like 3, not like 2, then or 3, not like 3 plus 2 equals 5. 32. Including mortality, that's what it is, death, cancer, cardiovascular disease, mental health, respiratory health, gastrointestinal health, and
you can fly to the moon, travel the world, or just stay in bed. You can't buy a best friend like that. but you can adopt one. There are millions of pets waiting for a best friend just like you. Help us save them all at bestfriends.org.
Woo! Man, these beats like this. Yes. Welcome back to the Grapevine. And you're on The Truth 101.7. American Family Insurance is a proud sponsor of The Truth for almost 100 years. They've been committed to helping families protect what matters most. Your home, your vehicle, and the dreams you're building every single day. And if you're a part of the Truth audience, you already know you work hard for yours. That's why having the right protection in place matters. American Family helps you stay ready for whatever life brings so you can focus on moving forward. Insure carefully, dream fearlessly with American Family Insurance. Get a quote or find an agent at amfam.com. Yes. Get a quote. We talking about health, like the food swamp. We living in food swamps. You walk down the street, there's no grocery store. Walk down the street, there's, this brown thing, staring at you on a menu item, menu board, like all that stuff is here. And I'm trying to figure out what is going on. I think we all trying to figure out what is going on. Early childhood obesity, like children as young as 3 years old are consuming ultra high processed food. Like before they even start kindergarten, before they can read. This is real biological damage, y'all. Real biological damage. If you're out and you're feeding your kids, because of convenience. And we all have been guilty for it. We all have been guilty. You get up, you got to get to work, and you stay by a Chick-fil-A. Even if you don't stay by a Chick-fil-A, they got that good breakfast. I never had that breakfast, but I'm just saying. You get that, you're like, hey, you know what? I know you're hungry. We're going to go by the Chick-fil-A. Get you that Chick-fil-A breakfast before you go to school, before you go to camp, whatever. And boom. And it's the same thing over and over again. Do it again. 2 to 3 times a week. And through the school year or throughout the day, throughout their life, in their school year ages, inflammation is building up. Though they're getting fatter. Obesity, fat. They're climbing. It's rising. And it's something that never gets connected. Documented associations between junk food and depression and anxiety in children and adults are at all-time highs. So if you are grabbing that junk food and you're like, man, you know what? We're just going to get this junk food. We're going to be all right. And all of a sudden, you turn around, you're like, man, I feel like something's going on with me. Like, well, what do you think is going on? You probably ask your friend. I don't know, man. I'm just sad all the time. What if you just ask your friend, like, what are you eating? Well, before I came down with this, sadness, I went to grab some McDonald's. I went to grab a Big Mac and French fries and a big gulp from S&A. And I ate it. I was feeling good, man. And then all of a sudden, I finished that big gulp and it was done. Like the next day I'm waking up, I'm like this. That's probably not what they're telling you, but I'm pretty sure that should be a real conversation between a lot of people. So these These aren't just like separate problems. These are all the same problems. Mental health is associated with food. Mental health deterioration, I should say, is associated with food. Plain and simple. They found consistent associations between mental health issues and deterioration and food. The moment you feel like you are, I know a saying that always says, like, if you feel like you're about to snap on somebody, grab some water, drink the water, drink a whole lot of water. Why? Because water is a neutral substance. It doesn't feed into negativity. You have to have the environment in order to make the water negative. But if you're pulling in negative food, if you have food that does not help the environment, your environment meaning your body, then you're going to produce more negativity. So that's double negativity on top. So on top of, whatever else you got going on top of your stress. Yes. And it ain't easy to burn it off. Like if somebody says, man, you know what, I'm just going to walk around the block and burn it off. No, it ain't that easy. You can detox, but it's not that easy. It's a concerted effort between your mind and your body. And they operate in the same mechanism. So ultra processed foods contain higher levels of what are called glycations in products because of the industrial methods used to manufacture them. So those compounds raise, and this is a little sciencey, but right, those compounds raise a blood marker called cystatin C, and that is directly associated with decreased kidney function. So basically, after one processed meal at a time, most people, I have no idea that happens. And cognitively, your mind starts to decline, and that accelerates, especially over the period of time. So there have been plenty of studies linked to ultra processed food consumption, and it's linked to, and that's correlation has been linked to, or there's a correlation between ultra processed food and dementia. So the same chronic low grade inflammation that's damaging your heart, damaging your kidneys, damaging your liver, damaging your adrenal glands, your lungs, is also damaging your brain. And it matters especially in the community that not only is facing 170-degree heat, 170-degree heat, facing high levels of Black maternal health death rates, but it matters in this case too. If we're a community that is facing high levels of hypertension, heart disease from ultra processed food consumption. And imagine a pregnant woman. I'm just not tapping down our pregnant women because we said that enough. But imagine a pregnant woman and she doesn't have as much support. Like people get busy, whatever it is, in your families. And she's like, man, I'm hungry. And what? Pregnant women, they're pregnant. They need to eat. And they're like, I want a burger. Ultimately, they're probably going to get it. But there has to be a subconscious and conscious thought around that burger and how it affects the child and also the maternal health of that woman. Straight up. It has to be. We can't bypass it. It has to be done. So there's been another major study that said food consumers had a 50% higher risk of death from cardiovascular disease overall, and a 68% higher risk of death specifically from heart disease. So cardiovascular disease and heart disease. That's real. This is real. All in a body that's supposed to carry out some level of purity. If you are living in an area and it's a food swamp, hit us up online in the chat. You could text us 833-212-1017. What do you want to do? What would you like to do in our neighborhoods? What would you like to do in our neighborhoods in order to make sure that, there's adequate food, adequate stuff, mineral-based food for your family to subsist on? I definitely want to support every independent grocer left on the north side. If you have healthy food, please show up and people, I need y'all to show up and spend money there, because the grocery store margins at this point are razor thin. The community purchasing power is genuinely one of the things keeping those doors open. So, double your SNAP benefits you can double your SNAP benefits at some of the Milwaukee farmers markets. And those programs exist now. And they're underused. So show up to a city council meeting, zoning meeting, and demand that some fast food permits don't need to be they need to be a part of some type of community review. You don't need a lot of fast food restaurants in our neighborhoods. Plain and simple. I don't care who the person is that you're friends with, that you cool with. They need to open this up and open that up. Nah, find something else. Make Milwaukee healthier. Straight up. It ain't all about $1. We selling our neighborhoods out for the dollar. When we come back, we're going to find out how we can better our neighborhoods, better our community, and what the health. That's our segment coming up next. We're going to find out what the health and our children working out. Holla.
Talking about guns with others might not always feel comfortable, but it could save a life. Here's a way to start a conversation. Your family is going over to your neighbor's home.
Yes. Welcome back to the Grapevine.
BeatStars.com.
Wow, that's dope. Welcome back to the Grapevine. I'm your host, Manon Sabir, and you are about to pick some grapes. You are in for a treat because this is our What the Health segment. It's very small. I'm experimenting with today because today is, what is today? Today, Wednesday? Yep, today is Wednesday, WINS Wednesday. We're going to keep winning. We got to keep winning. I didn't mention that the first part of the show, but today is Wednesday, WINS Wednesday. I want y'all to win. So that's why I'm going to keep feeding y'all all this winning information, all this winning. And in our segment of What the Health, I'm going to bust a myth. I'm going to bust a myth. Yeah, I'm busting a myth.
Pause.
Okay, listen. I'm going to make sure this myth is not perpetuated in the city of Milwaukee. All right? Period.
Why not just debunk?
Debunk. I'm going to debunk this myth. That's a straight up this. Hey, look, y'all, I'm about to debunk this myth. I'm going to bust it. There's a myth that says that And today in our What the Health segment, there's a myth that says lifting weights is unsafe for children and will stunt their growth. Wrong. Who said that? Somebody said that in a film. Wrong. That's wrong. If you have a child and you're working that child out, whatever you guys are doing, walks and stuff like that, if you have told your child this, or you're telling children this, please stop. Please stop. I'm not going to tell you again. Please stop telling children that lifting weights is and will stunt their growth. That is wrong, completely. And I'm going to read something from the American College of Sports Medicine. And I'm going to say it again. Lifting weights for children is okay. Is okay. We're going to debunk the myth of lifting weights stunting your growth. That is wrong as a child. One of the most common myths associated with youth fitness programs is that resistance training is unsafe, and harmful to the developing skeleton of children. Unfortunately, these outdated views persist today, and some parents and caregivers question if children should lift weights in school and community-based programs. Listen, yes, please allow lifting weights back into our grade schools. Or if they haven't ever been, introduce lifting weights to our kids in grade schools. 6, 7, 8, 9, 6, 7. That's crazy. 6, 7, 8, 9 years old kids. Like, allow them to lift weights. It's okay. Let them lift the weights. It's all right. I want my child to lift weights. I want her to be stronger. Like, earlier the better, because I love my baby. And there's a way to, I forgot the science, I forgot the term, but when your children have strong cores, they become stronger mentally. They become smarter mentally. When they have strong bodies, they're able to think on their own and also faster. So, despite public recommendations encouraging children to participate in muscle strengthening activities, encourage them. No scientific evidence indicates that participation in a well-designed youth resistance training program will stunt the growth of children or harm their developing skeleton. In fact, childhood seems to be the best time to participate in strength building activities that enhance bone mineral content and bone mineral density. With qualified supervision and a sensible progression of training loads, regular participation in youth resistance training can have a favorable influence on bone growth and development in girls and boys. So, since today's youth are weaker and slower than previous generations, the time is right. The time is right now to just incorporate strength building exercises into youth fitness programs. In addition to gains in muscular skeletal strength, youth resistance offers a variety of health and fitness benefits, and we're going to read those out, that can prevent the decline in physical activity and upsurge in decreased risk factors early in life. Moreover, new insights into the design of youth fitness programs have highlighted the importance of participating in strength and skill building activities. In exercise and sports activities, indeed, the unique benefits of resistance training should not be overlooked when designing youth fitness programs. I'm going to move forward. The key is to provide qualified instruction and load on the right dose. The truth is that resistance training can be a safe and effective, worthwhile activity for children if the program is supervised and well designed. We also have to remember that allowing our children to participate in muscle strengthening activities will allow them to be intelligent human beings. Straight up. This is real. Allow your children to lift them dang weights. For real. Al, what's up?
Well, I'm going to tell you what's up. You know what stunts kids' growth?
What?
Religion.
Oh, man.
Religion.
Oh, wow.
Allow these kids to be kids. Stop putting your own personal beliefs on that child and let them be a judge and let them be a kid. Because, see, when some of y'all was growing up, you was allowed to be a kid. Wasn't nobody pushing all that religion and Bible version of what's wrong in your eyes. That is a child. Let them be a child. Don't put your baggage, your beliefs, your downfalls, your mishaps, and your baggage on your kids' shoulders. That's why these kids is all effed up in the head now. When these kids come into this world, they are a loving spirit. How dare you push your religion that works for you? And some of y'all didn't get the religion until you was beat down by life, and then you had to be scared in submission. Allow your kids to be kids so they won't be taken advantage of. Don't be telling your kids they're going to hell or Eve was created from a rib. That's why they all jacked up. Allow a kid to be a kid. The same way y'all was allowed to be a kid.
I appreciate it. I appreciate it, Al.
Y'all got secrets.
Thank you. Yeah, some of them got secrets, man. You know, it's funny because, you know, there is some truth to what Al says sometimes. And Al, I feel you. Like, yeah, you have to allow kids to be kids. You definitely have to allow. That's my wisdom from what I got from you, Al. We have to allow kids to be kids. Guaranteed. We can't push, you know, a whole bunch of stuff down their throats. It's hard for them to take it. It's hard for them to intellectualize. They're kids. Kids are made to play. That's one thing. They're made to play and experiment. I heard somebody say, whenever you have a child, when children are around, they're moving around, they're big balls of energy. One thing you shouldn't do is tell that child to stop. Yeah, like if it's something burning hot, then yeah, you pat their hands, whatever you gotta do. But one, if you're telling that child to stop and it's, you know, kind of a minor thing, then
providing clean drinking water in Haiti. We're in more than 70 countries worldwide, bringing patients from sick to recovering, from emergency to aid, from crisis to care. This life-saving care is made possible by a global movement of supporters like you. Thank you.
Yep. Welcome back to the Grapevine. Welcome back to the Grapevine. I'm your host, Manon Sabir. And let me give you a number. Before I give you that number, I was about to give it to you. Oh, no. Before I give you that number, I want to ask you, are we raising men or are we raising boys? Are we raising men or are we raising boys? So masculinity, fatherlessness, digital dad, Milwaukee mentorship crisis type of conversation. Let me give you a number. If I want you to hold it before I explain it, in February of this year, community organizer, our good friend, our good buddy, our good uncle, Andre Lee Ellis, who's been doing this work for many, many years, founded the 500 Black Tuxedos program. And he tried to put together one of his annual event at one point. And the premise is straightforward. 250 black men show up to mentor 250 black boys between the ages of 12 and 17. Full day of workshops talk about violence, talking about anger management, talk about men's health, artificial intelligence, incarceration, careers, stuff that these boys need to hear from men who look like them. Andre Lee Ellis had about 200 boys registered, and he only could find 78 mentors, male mentors, I should say. He had to postpone the event. 200 boys, 78 men. And and I don't know, and correct me if I'm wrong, but I don't know if the event went on in some other venue or whatever, but I would love to have somebody come in and talk about it, because that's important. But 200 men, 78 men, 200 boys. This is, Milwaukee masculinity crisis in one number. It's not a theory. It's not a statistic from a national study. 200 real boys from this city waiting. And 78 men answered. Now, let me put that in context with the broader data, because Milwaukee doesn't exist in isolation. It doesn't exist in no isolation. Approximately 18.3 million children in the United States, 1 in 4 live without a father consistently present in the home. So 80% of single-parent households are led by moms. And this is no, mic drop against moms. Everybody's doing their best pretty much. But in Milwaukee, given the compounding effects of mass incarceration, economic exclusion, and the generational poverty created by the very policies we've been talking about all afternoon. Redlining, food apartheid, food swamps, environmental racism, systemic racism, those numbers are concentrated specifically in black communities on the north side. And boys are growing up in the homes where love is absolutely needed, but it also needs a male structure and male modeling that often is not embedded in the home. And what fills this gap? What fills the gap? Who fills the gap? What does a 14-year-old black boy in Milwaukee do when there's no consistent voice, no consistent male voice telling him what strength actually looks like? What does discipline actually look like? What it means what does it mean to take responsibility for your choices, your chores, your people, your neighborhood? What does that mean? So in 2026, researchers are naming something they're calling digital dads. I don't know if you guys ever heard of this term, digital dads. If you have, please put it in the chat. Like, have you heard of this? Have you heard of this term, digital dads? I want to know, because it's basically online influencers and social media algorithms they're in the absence of any real male role model mentor shaping a young boy's idea of what manhood is supposed to look like. And so digital dads they're basically selling a version of masculinity built on, dominance, like alpha man, emotional suppression, like take it all in, on treating vulnerability as some type of weakness. Like being vulnerable is weak and aggression is power. And it's super catchy. Like these digital dads, they kind of they winning out here. They catching your kids, they catching your sons, they catching. And if the community isn't raising your son, then, people like, and I'm going to say it, people like Andrew Tate and not Jason Williams are raising your son. Andrew Tate is. Jason Williams is preaching the truth, the real gospel. But he's only one person. He's only one man. We gotta get on the wave also as men. So this is an actual choice in the community that we are facing. And I need to say two things that are both true and that people on the east side of this debate you may not want to hear. So first thing, yes, boys need to be pushed. Boys need structure. Boys need accountability. Boys need to be told no. They need hard enough, consistent enough, something. Boys need to experience real challenge. They need to experience difficulty that they got to push through because the world is going to present real difficulty regardless of whether you prepare them or not. They're going to face real difficulty. Quite like the story I told when I was 19 or whatever, and dang, cop pulled me over and, falsely took me or arrested me, not necessarily took me into the station, but falsely arrested me and then threw my keys in the field. Yes. We are going to face, as men, we're going to face very high level, difficult moments. But the martial arts taught me, being pushed isn't a bad thing. Being a man and learning how to equip yourself to be able to handle what is coming next is okay. You're going to fail. You're going to disappoint yourself. You're going to disappoint others. But as long as you continue to get up, martial arts told me things about my own capacity that nothing else could have taught me. And that pain is information, not a stop sign. It's not a stop sign. Just because you face pain, that don't mean you gotta, just because you face pain, that don't mean you gotta stop. That's where the growth happens. That's where discipline that you build in training, that's where it shows up. The pressure in real life. And boys need that. Not every boy, needs a black belt like I got. Not every boy needs something that pushed them past something that's easy. But the second thing is, and most crowds were gonna say that, just toughen them up. Just toughen my son up. Just toughen him up. That's like the old model of emotional suppression. And it has its own body count. It got its own body count. So the generation of men who were raised to never show emotion, like, man, don't show no emotion. To man up through everything, to bottle and suppress and silence. Those men are dying by, hook or crook. They're dying at high levels of suicide rates than previous generations. A lot of them are in prison. They're also self-medicating themselves with alcohol and other suppression ingredients. And all of this, once it's inside the pressure cooker and the pressure gets too much, it explodes. It explodes. That's the pressure cooker. So the boys who suppress everything don't become warriors. They become men who can't communicate under pressure, who can't build intimate relationships. They need to lead into love. They self-destruct quietly and also publicly. It ain't talking about boys. Boys, are we raising them to be men? Or are we raising them to be soft? Are we raising them to be men? Or are we raising them to be soft? Is this something that we need to address right now, or can we put it on hold? Can we put it on hold real quick? Man, this is a real subject, because we got a lot of our boys soft. Our boys soft in Milwaukee? Is that even a qualified term? Are we qualifying that term right now? Somebody, I want to know. 833-212-1017. Are our boys soft? Do they lack emotional discipline? I really want to understand, and I think they do too. The ability to absorb real pressure by our boys, they and processing it honestly and respond from that place of clarity and purpose rather than reacting from a place of panic or ego takes courage. It takes a small bit of pride. It takes a community of maybe a high level magnitude from a man to help that boy recognize his own worth. That is what makes a man safe to be around, because he's able and he's capable of leading his family, his community, and his city. So if you're showing up in your child's life, in a boy's life, and you feel like you need more help and or you can offer more help, please talk to Andre Lee Ellis. You can go to 100 Black Men of Milwaukee. You can you could go to the Black and Latino Male Achievement Gap program. You can reach out to 500 Black Tuxedos. You could go anywhere you would like in relationship to seeking out Black male leadership and foundations for our children, our boys, to be taken care of emotionally and the rest. So let's show up for our boys as best we possibly can, straight up, because this is real. So we're going to take a little turn. We're going to talk about Cedarburg. You're going to talk about Cedarburg and how I went to Cedarburg, and this is a crazy thing. I went to Cedarburg for the Strawberry Fest, and honestly, it wasn't bad. I think it drew over 100,000 visitors. It was, I don't know if you know where Cedarburg is, but Cedarburg is basically 25 minutes north of Milwaukee on highway or Interstate 43. And, they had a whole bunch of stuff going on, man. It was packed. It was packed. I'm surprised that it was very measurable. It was all right. But I want to be precise about something before we go further. I searched specifically for documented racial incidents at the Cedarburg, and this is the truth. I did, I do it regularly but I looked for documented racial incidents at this year's Cedarburg Strawberry Fest, and I came up with nothing, very empty. It was like how I saw it. It was straight up, cool. A lot of folks were there. They did their thing. They participated in a lot of events. I think there was a little small concert or two. So, people were out. People were definitely out. But there were no news reports. There were no documented complaints, no verified incidences. And I'm not going to fabricate something that isn't there, because this show is, pretty much built on facts, not feelings, not emotions. But here's what I did find. It actually is more significant and more damning than any individual incident. Is Cedarburg has a population of 13,000 people. Of those 13,000, 0.3%, about 44%, 44 people identify as black. So that's 44 black residents in the entire city. Not bad. Milwaukee sits 25 minutes south and is approximately 39% black, meaning Milwaukee County. We are of the most diverse cities in the Midwest, sitting 25 minutes from one of the most homogenous communities in Ozaukee County. And Cedarburg's neighbor, Mequon, is separated from Cedarburg by like a handful of miles, so just a couple miles. And it's classified in this particular study as, which is the only academic study. It's called the Lowen study. Lowen, I think, it's got it by the name of James Lowen. He was at Tougaloo College and one of only three. So basically, Mequon, I think, is one of only three Wisconsin communities surely classified as a sundown town. So a sundown town is a municipality that for decades actively kept non-white people and black people specifically separated out through some combination of law, restrictive intimidation or violence. So that specific evidence basically earned Mequon that classification, that census data. And that was back in 1880s. Now, if you know Mequon is pretty much like it's a good, it's a place where people can come and go. They basically turned it around. Looks like they turned it around. But Mequon as a city, historically, was a sundown town. And there's particularly in that particular study, there have been a number of sundown towns, and they're all kind of a part of this particular this study by Lowen. Rosewood, which had made it made a national and international and national attention based around the movie, was a very interesting city. Rosewood was thriving, and at its peak, it was a predominantly black community. But at its peak, Rosewood had like 3 churches, a Masonic lodge, a school, a large community center, a sugarcane mill, baseball team, and I think the Goings family was one of the more prominent families in Rosewood. So, and they were the second largest landowners in the entire county. But there was a incident where somebody was quote unquote allegedly assaulted by a black man, and then riots happened. Basically, some fights happened, and Rosewood folks defended themselves against further attack. But the white men burned every building in Rosewood to the ground except for the white-owned general store. And they hunted black residents through the swamps, and no arrests have ever been made, ever. So that's the kind of the gist of sundown towns, man. And I'm here to say that when I went to the Strawberry Fest, like we can do our own thing. We can do our own thing. You know, we don't have to necessarily go out to the Strawberry Fest in Cedarburg. We don't have to necessarily go out to the Strawberry Fest. We can have our own Strawberry Fest right here in Johnson's Park and do our, have our own strawberry patch or have our own watermelon patch or have our own apple orchard or cherry orchard. We can have our own thing right in our neighborhood. We can have our own music and the likes right in our own neighborhoods. Matter of fact, we got people who are, they're fantastic farmers, fantastic gardeners. Now you got a person like Venus Williams, not Venus Williams from, the tennis, but Venus Williams, our favorite gardener / farmer. We have Venus Williams who does her thing and takes care of our community on a statewide basis. Venus Williams, Will Allen, just a number of folks. Andre Lee Ellis. These people, and there's a lot more people. But they're doing what's right. They're doing what they're made to do. So, and that's take care of our community from a natural and holistic perspective. Hey, y'all.
Room to perform.
Supporters of DEI policies argue that keeping them in place doesn't stop high performers from getting jobs they deserve. It just grants more people the opportunity to compete for them. I'm Bloomberg's Justin Milliner on the Black Business Beat.
Hey, stop.
No. Yes, man. We're almost towards the end of the hour, and I'm having fun with this because there's times where I just like to just talk about specific topics that are really helping us. So on June 29th, day before yesterday, a woman was attacked. I think it was in Fond du Lac County. She was attacked, and she had her 1-year-old child with her. She was attacked on like what they call a valley trail. It was in the village of some place called Rosendale, Wisconsin. And she fought back. She was walking with her 1-year-old, fought back, broke free, grabbed her son, and ran to a nearby home, called 911, and they found this dude that was walking around doing basically the same things because he attacked somebody else. The woman is alive. They caught a guy. I think they caught him, and he's now up on charges of kidnapping. The whole bit. But I want to give you like real specific tactical information about what happened and why it worked. So, I'm not just a person that will give you statistics, give you a story. We talk about something fun, talk about something serious, and I go sit back and go home. Like I'm a real tactical individual in relationship to, fighting. That's what I do. And this is not generic, so make sure y'all be careful out there type of advice. This is not trust your gut with nothing to back it up. This is actual tactical understanding why this woman's response was correct and how you can be prepared to respond the same way. So first and foremost, the most important principle in safety of an attack in a situation is you're not trying to win. Y'all not trying to win a damn fight at all. The goal is to create an opportunity to escape. The goal is to create the opportunity to escape. That you need space. That's what you need. Military and law enforcement people, they make this distinction very clear because it constantly changes everything of how you respond. You're not trying to knock somebody unconscious at all. If you get the opportunity to, then, and you got a base, you are accurate, like you about to swat a watermelon, then if you got the opportunity to, then go ahead and get it done. Like bust the watermelon. But don't try to hit a grape with a twig. That ain't gonna happen. Don't try to hit a grape with a twig. Nah. You got to try to create space. So we're trying to create at least 2 to 5 seconds of physical space and disruption, confusion at the very least, in order to get yourself and your children out of reach. And this woman, that's what she more than likely did that because she was able to get the person away from her, grab her baby and run. That's your first defense, is to run. So this was basically textbook. The attacker's plan, an attacker's plan is to freeze your response. It's straight up to make sure that you are shocked, you in disbelief. Man, you can't believe, and they want to have power over you. They said the attacker covered the lady. The lady said the attacker covered her mouth with a cloth and grabbed her around the neck. And so once that person has a control point, he establishes like where they're going to, grab you and try to, now they're looking to take you someplace. And so how you counter each control point will determine how much space you have between you and that attacker, period. So for them covering for that person covering that woman's mouth, that the person's goal was to prevent the screaming and stuff like that. So your first move, somebody does that. If somebody does that, tuck your chin down immediately. If somebody grabs you around the throat, tuck your chin to your chest immediately. So they don't have an open space to grab your chest, grab your throat. The next thing is make sure that you have that other hand or some other device or whatever from that person trying to get the other hand around your face. The next move is to bite. And this ain't no metaphor like bite their hand, bite their fingers, anything cover your mouth that can prevent you from screaming. Make sure you do that. For the neck grab, like if you have, I'm demonstrating right now so people will understand, because this is real. Like it happens in Milwaukee, and a lot of times we don't even report it, but it happens a lot. So, and there's, it's dudes out here trying to take advantage of women, and y'all got to stop. Straight up. Y'all some dummies. Please stop. Dum-dums. Yo, listen, so you tuck your chin into your airway, drop your center of gravity, and turn your body into the direction of the attacker's thumb. That's their weakest point. Grab anything and that breaks the hold of their grip. Then you turn around. You gotta fight your way through. Fight your way through whatever they are, putting up. Whatever they're trying to do, if they're trying to grab you, fight your way through it. There's three targeted zones that I want people to remember. That I need you to remember. That's aim for and that's regardless of their size. Regardless of the size. It's 3 targeted zones. Any forward pressure with fingers or thumbs towards the eyes is good. The person's unit, the groin, make that happen. Up, hit them in the knee, with your knee in the groin. It could cause real serious injury. And if a child is present, I'm gonna say this. You gotta protect your child. Your survival is your child's survival. You can't it's imperative that not just win, but that you get away with your child from that particular person. So I'm going to make sure that you guys have this in this segment, but call 911 immediately. Give the most specific description of the attacker, and if you are in walking trails and all of that, you want bright colors, reflective gear, and also you want to make sure that you're walking with somebody, and give people where you are. Let people know where you are. Vary your routine. Make sure your routine isn't the same. If you walk the same trail at the same time every day, that pattern needs to be mixed up. Don't put both earphones in both ears. Keep one earphone free, straight up. And your hearing is a detection system. Carrying something is all right. Like, you need to carry something, yeah, carry that bear spray, pepper spray, whatever it is you got to do, make sure you carry it. Make sure you carry it. Because that's important. Violence against women is a public health issue, and it's also correlated with poverty, with violence, resource deprivation, and the same structural, a lot of structural inequities that this show has been talking about all afternoon. So safety knowledge is a health resource, y'all. And every woman, every parent in Milwaukee deserves access to it. Remember, another weapon is also a personal alarm. So you can, a lot of times they have clips that you can clip to either your purse or a stroller, or wallet that has like something on it, like, or you put it around your belt, wherever it is. Make sure you have that. Make sure it have a lot of noise. You make sure you make a lot of noise. Make sure that you are walking with somebody, and just be aware. Just be aware. This is the period of time when a lot of folks, they want to be outside. It's nice out. It's at night. It's 70 degrees. You want to spend some time by yourself, and you, if you do want to spend time by yourself, then make sure that you are doing it safely. So, Milwaukee, do what you gotta do. Do what you gotta do. We're gonna come back. We're gonna bust through these next 30 minutes. We're gonna take some calls. We're gonna go on a little tangent with our with our listeners that are on the chat, and we're gonna see where it takes us, man. We're gonna just keep rocking. That's all. Just keep rocking. This is Truth 101.7. I'm your host, Manon Sabir. We're gonna be back in 2.
We asked parents who adopted teens to share their journey.
When I met both of them, it was like my missing pieces were found.
That beat, I ain't gonna lie, man. That beat is so dang fire. God, dog, boy. For real, that beat is fire. I'm trying to figure out if we can get Venus. I will need a call to action, man. Like, I'm still on this. Welcome back to the Grapevine. We're gonna pick some more grapes. But I'm real call to action-y right now. Like, can we get some call to action? Can we get Venus Williams? I'm just digging in the crates now, but Venus Williams, Andre Lee Ellis, come on, y'all. Y'all are the bomb. Straight up. We need y'all. We need y'all straight up in this community in Milwaukee, because we don't need to have we don't need to go out to the Strawberry Fest. I'm still on this. Yes, I am. We don't need to go out to the Strawberry Fest. I went to the Strawberry Fest. I'm going to tell you this story. I went to the Strawberry Fest, and shout out to the organizers of the Strawberry Fest. We not hating. However, we can do our own thing. We don't need to have, a number of individuals a number of black individuals at the Strawberry Fest, at the Strawberry Fest. We can do our own Strawberry Fest. And it was like 5 to 6 tents that had strawberries. And they sell, no, if I'm at the Strawberry Fest, I want at the very least 10 to 15 tents selling different varieties of strawberries, all of that stuff. So I need y'all to we need some help. And we can do a watermelon fest, a cantaloupe fest, whatever it is. Like, we can do chocolate covered, whatever. This can happen. I'm sure that we can do our own thing. We can have our own music. I want to see if we can if we'll be able to have more, if we'll be able to have vendors. If any vendors are out there, I'm gonna do it I'm gonna do it myself. Like, might as well have our own vendor, like Strawberry Fest. Where should we put it? Should we put it at Johnson Park? Or I don't know. I'm trying to think of some of the neighborhoods. We need to put it right in the neighborhood. Like, maybe we should just block off that street where Andre Lee Ellis, where he does the gardening. Maybe just block off that whole entire area, the whole block. Just block, not just the block, but blocks, and just have vendors and a farmer's market right on that block. And then they combine, minds, Andre Lee Ellis, Venus Williams, other people that have natural products, and then we put that stuff right on the block. We ask the homeowners and the people who are living in those homes, we ask them to be vendors. We help them set up their own vendor opportunities so they can make money. Right there, right in the neighborhood. That's how we lift up a neighborhood. What would y'all do? What would you do? What would you need to make happen in order for us not to have to go out to the Strawberry Fest? And I ain't gonna lie, that drive is dope. Dope drive, a lot of trees, whatever. But we can have our Strawberry Fest right here. We don't even need to call it Strawberry Fest. We can call it I don't know. I'm Gucci Fest. Call it whatever, like something real fire. Like, see you later, Giannis Fest. Shout out to Giannis though. He's my guy. But I'm just saying, what do we need to do? What will we name it? I'm gonna go to the chat real quick because the chat's been waiting. We got a caller. Okay, a couple callers. Wes, what up? I'm gonna hit the caller first, and then I'm gonna hit the chat. Wes, what up?
How's it going? I appreciate your topics today. They're super on point, especially all your Sensei Wu karate stuff is very useful, especially for people here in Milwaukee. Not to say people are bad, it's just people are on tough times. Yeah. But I think you kind of summed up all your situations when you talk about food deserts, women's health. All the way down the line, are men boys? Are you training them to become men themselves? It's kind of just surroundings. You should be aware of your surroundings. I'm sure as a karate guy yourself, you'd agree to this. Your surroundings are kind of key to everything. Yeah. So for me, I surround myself first by not being in sinful areas, right? Anything that has to do with lying, cheating, stealing, immorality, right? People, two-faced people, double-standard people tipping the scales, murderers, pedophiles, anything to do with that. I'm not going to surround myself anything to do with that. I'm going to surround myself with the most wisest, most intelligent, caring, loving people there is, and most of your problems you can get solved just by asking them. I mean, I really hope people listening go to church more, not for the religious thing. Al is totally right. stay away from religious people because usually they're the people doing bad. You got to stay next to the people that are actually wanting to help. But people at church really do want to help somebody, but they just don't know who. So if you go there and ask people at church, they'll help you. It's their job. That's why they go there, because they're trying to find somebody to help.
Yep.
So I suggest that. But Al's great. You know, when he said what he said, and he's absolutely right. You know, he doesn't like any of those bad, sinful type characters that I listed off, and he wants people to just let the kids be kids, which is what you should do. Let your kid be a kid, but it starts with the roots, just like the roots of a tree. And this is why you got on the gardening topic, is it all starts with roots. Good roots produce good fruits.
That's
so,
right.
You know, when the parents are doing what's right, the kids will grow up to be responsible and to work hard, you know, especially on the farm. You're talking about kids weightlifting. Well, hey, these 8-pound buckets of water that you got to walk, you know, 2.5 blocks out to the woods to go to the well to pick up and walk all the way back just for the animals to drink out of, it's not light, you know, and the kid has to do it, you know. And then when I hand him a snippers, hey, I need that 2 acres of field, you know, snipped of all the thorns so then we can plant some stuff so we can have food for next year and the next 10 years after that. You know, he's got to go and do it.
That's
you know,
right.
and it builds up muscle, it builds character. It allows him to then, you know, invite his friends over. And, you know, we pitch in a little bit of change for everybody. And if we can't afford the money, then we give him some food. You know, and as long as you dehydrate it and vacuum seal it, it lasts 10 years. This way you don't have to worry about food deserts. So I highly suggest, and I like your idea of bringing in not only Strawberry Fest, but just more farmers markets in general. And I think Center Street, you know, the apartment complex that I own is on 49th and Center.
Yeah.
I suggest do it on that block. Like you said, get a permit, shut down the block. It's usually shut down by caution tape for people getting shot anyway. So just go ahead and use that block. It's a good place to start, right in the center of Milwaukee. And people will come. And if you build it, they'll come. So I have high expectations for Milwaukee. There's a lot of good people and people that just don't know they're good yet. And I got great hope for the future.
Man, I appreciate it, Wes. Thank you. I appreciate it. As a matter of fact, my dad always said that if you're at a spot, you know, of religiosity, you know, you don't necessarily, if you don't partake in the religiosity, then it's okay. But, you know, those places, those temples, those mosques, those synagogues, wherever place you go to is a hospital. It is a hospital for the people who are weak, who are sick, who are shut in, all that stuff. You know, people for the sick and shut in. You know, we're gonna take some what is it? The collection plate for the sick and shut in, and they had the ushers at the church and stuff like that. But in reality, like you're exactly right. We have to you have to realize that there are people there that on the other side, you have to realize that people are there to help you out too. So if you're in those places, they're not knocking them. You know, some people are a little harsher than others in terms of this particular piece, but you are there to get help. So seek the help that you can consistently get, or that you consistently see on a regular basis, whether it's a Wednesday, Sunday, Monday, wherever time you go to church, a Saturday, whatever time you go to church, make sure that you're seeking that help. But then the other thing is, and Wes is right, you know, maybe it's this shutdown of Center Street. Maybe this is Center Street days. Just shut down Center Street. You shut down North Avenue, you know, parts of North Avenue. You have it in different areas. You shut this down in order for people to have, you know, their own thing. That people to feel healthy, to feel good. And this, you just do this regularly. You don't have to go downtown. And I'm not knocking the night market, because I partake in the night market every now and then too. So like, you go down to the night market, you go to Cedarburg, like, but then we look at, you know, there's an African fest, and there's some of these other smaller fests, and there's block parties. But what about a one big fest that promotes healthy food living? That's fun. That's fun to be around, and that's right smack dab in the neighborhood with the most problems. That is one way how you can control the narrative in a community by putting it in neighborhoods in which you can call on folks that haven't been called on. You know, these folks people want to work. People want to do things. They want to make things happen. I do. I do. On our chat, let's go to the chat real quick. Jasmine West says, hey, y'all, don't go and share information with others. That's funny. Hey, Jasmine. Robert Lass says, Shaky says, as long as it's done safely, starting young also programs the body for enjoyment in that type of physical activity long term. Yes, that's talking about working out. Wesley also talked about that too. Robert Lance said, don't know about that, Al. Jasmine West said, hey, Robert. Looney 504 said, them damn police. E. Wright said, I recently took a self-defense class with EPU, that self-defense, and I highly recommend it. John Fletcher, that's his name, a good colleague of mine in the martial arts, is an outstanding instructor who teaches practical, real-world techniques in a supportive environment. I should call John on the real quick. E. Wright says, every woman should consider taking one of his classes. You never know when these skills may be needed. As a matter of fact, people, you don't realize how long these skills, you don't realize if you will need these skills or not. However, they're necessary. They're necessary tools. So I am happy that you all are taking part in the Truth Radio 101.7 Love. We have a few minutes left, and I don't want to waste it. So when we come back, we're gonna
gets drowned out. Your life sounds pretty great. Don't let a buzz ruin it. Buzz driving is drunk driving. Don't drive buzzed. A message from NHTSA and the Ad Council.
Yep. Back and 4th of July. All right, Milwaukee, we have been in it deep all afternoon. All afternoon. It's heavy, it's important, it's real. Before we close the show out, make sure that we get our sponsors together. Yes. Yes, get ready. 101.7 The Truth Family Fest is back. Join us Saturday, August 22nd from 11 a.m. to 2 p.m. at Riverside University High School. Okay, Riverside. For free back to school resources, live entertainment, family activities, and community fun. Vendors and sponsors can reserve a spot by emailing sierra.brown@milwaukeeblackmedia.com. That's CIERRA.brown@milwaukeeblackmedia. MilwaukeeBlackMedia.com. Proudly sponsored by Educators Credit Union, Gruber Law Offices, and American Family Insurance. And at UW Milwaukee, students don't have to wait until college to start building their future. War Ready lets students in K through 12th grade join in hands-on programs across campus, from science and tech to sports and more. Try new things, meet new people, build skills that matter. Get started today at uwm.edu/war ready. Yes. Yes, sir. And we are back. And I'm glad y'all back. And I want y'all to remember, like, celebrate all the way. Go if you gonna go in. My daddy said, if you're gonna do something, just go all the way in. He really said, if you're gonna he probably cussed a little bit on that side too. Like, if you're gonna go all the way in, go all the way in. Go all the way. But make sure you're safe doing it. Make sure you're safe doing it. Make sure you are safe. Like straight up. That's one of the things I've been promoting today. Honestly, is safety. Safety with your body. If someone is, out here, you walking alone and you got things to, you got things in your hand, you walking from the store to your car, you walking from your car to your house, be vigilant, be active with your eyes. If you carry your keys in your hand and be ready to, give it to somebody just in case they run up on you. For real. Not all of y'all can't reach in your purse and grab that, that piece and do something with it. That's not practical all the time. That ain't practical. And most of you ain't got tactical skills. So you gotta, practice being vigilant. So 3 days from now, this is an honest conversation. 3 days from now, there's a holiday that's coming up, and it's called the 4th of July. But for Black America, that may not mean anything. That just means we gonna have a cookout because somebody cooking out. And for me, I love, I have cousins and relatives all over the country, and I visit people in different parts of the country, and I love large cookouts. I love the smell of the food, the smell of the charcoal, I love the music. I love the family. I love the fact that the whole city just kind of slows down, and it's cool. It's real cool. And we get a breath of fresh air for that moment. And that part is ours. We do, and Black people, we do summer pretty much better than anybody in the world. We are the best summer organizers of parties and all this stuff. Like we come out to get busy. Matter of fact, if you've ever been to Chicago, I'm just talking about Chicago. I'm talking about Milwaukee. We talked about Milwaukee all day. You ever been to Chicago, that House Music Fest? And I think it might be Grant Park. Man, that House Music Fest and over there going down. Jazz, you ever been to that House Music Fest in Chicago? About that. So yes, it goes down, like for real. And I'm like, dude, if people, Meech, you ever been to the House Music Fest in Chicago? About that. Never mind. Man, they in there. Like it goes down. I've been to the House Music Fest in Chicago, and I swear to y'all, it looks like one big black spot, one big brown fest. Like people got lawn chairs, and they have music. They got their own little music out there. They bring their little BYOB. They have like all of that. It's going down, and it's like house music. Like, man, off the chain. So, but we, Black folks, we'll die on a hill for the summertime, straight up. Especially if you living in the North, you go all out. Dude, that's basically what your summer wardrobe is for. Your summer wardrobe is not to work. Oh yeah, Zayda Shay said you went this past year was going down, right, Zay Shay? You need to call in, man. Come on, call in and tell us how it went. 833-212-1017. I bet it was going down. Like, it's so huge and everybody gets along. It's one of the best things you can do. So I'm not advocating y'all just go to Chicago because we talking about Milwaukee, but we talking about the 4th of July, and it's cool. But here's a little something I need to ask y'all a question. I need y'all to be honest with yourself when you answer it. So when those fireworks go off on Friday night, what exactly do you think you're celebrating? Because here's the historical reality that nobody puts on a Hallmark card. On July 4th, 1776, when the founding fathers were, they signed the Declaration of Independence. Probably, I don't know when they signed it, honestly. They probably, it probably was some other day. And they declared that all men are created equal and are endowed with their inalienable rights. There were approximately 500,000 black people still enslaved in American colonies. So that's 500,000 people that ain't even applied to. Frederick Douglass, he was enslaved. He was one of the most powerful orators in the world was enslaved. 1852, he was invited to speak in Rochester, New York, July 4th. And he said this. He said one of the most devastating and precise pieces of it was probably one of the most devastating and precise pieces of speech he could ever deliver and someone could ever hear on American soil. And he told the audience that the July 4th holiday was not his. It wasn't his. And I want to know, and this is something to think about, is it really ours? Is it something that we need to celebrate? So my time is coming to an end, and hopefully you guys received a lot of information. We talked about women, maternity health. We talked about men protecting our women. We talked about boys, whether or not boys, are we pushing our boys too hard? Are we not pushing them hard enough? We talked about the heat. Please, whatever you do, protect yourself. Celebrate yourself. You ain't got to celebrate. You right, Looney. You ain't got to celebrate the holiday, but at the very least, celebrate yourself. Be happy with what you got going on. Because one thing I always tell people, your anger, you don't take that. You could take that to the grave. It is never on your obituary. Your happiness is on your obituary. And if I haven't told you once, I'm going to tell you 1,000 times. This is the Grapevine, and I love you. We